welcome to all of you who are joining us on probably on Facebook, but you can also find this special event starting in just over 2 minutes on LinkedIn, Facebook, as I said, Twitter, YouTube. So wherever you may be, a warm welcome to you. We are looking at your messages. I just want to already acknowledge Emma, a radiographer from Croatia, who's watching on YouTube and who just joined. Hello back to you. I hope you're doing well and looking forward to this event. There's also Margarita, a radiography student from Poland. And this is one of the several ways in which this session will be interactive. We're looking at your comments, and yes, please say hello. Tell us what city and country you're connecting from. And also, as you listen, share your questions, share your experience. You'll be hearing a lot of really powerful, compelling testimonials and be invited to really respond to them and to join the dialogue. See you soon. Warm welcome to you. I'm Rida Sadki from Geneva, Switzerland, and from the Geneva Learning Foundation. Welcome to this special event on communicating radiation risks in pediatric imaging. You may be watching us right now on YouTube, Twitter, Facebook, or LinkedIn. We are broadcasting across all these platforms, and wherever you may be, as you're going to see, we will be reading your comments. I can see many introductions. As so many of you have already figured out, you can leave comments. I just want to say hello to Salonika, Joy Akyangan, BSRT student from the Philippines, Patrick Ambrose Okello, radiology resident from Kampala, Uganda. Camille Leroux doesn't just says hi, which is fine. Tell us what city and country you're connecting from. Shaki Ahmed from Bangladesh, Kristin Norwig Galvao from Brazil, Monica Akinlosotu from Nigeria. Wonderful to see so many people here with us in the room. We also have 3 distinguished experts, Dr. María del Rosario Perez from WHO, Dr. Don Frush from the Image Gently Alliance, and Dr. Joanna Kaznia-Brown. So we will be hearing from them today. But first of all, I'm going to tell you a little bit about this event and where it's, why and how we came to organize this. So first of all, this is going to be about radiation risks and communication to improve benefit-risk dialogue in pediatric imaging. So that is the first point of information. Second, the reason we're having this special event is because WHO is launching a pilot course on this topic, and the course will be, applications are closed, so if you just found out about it, you won't be able to join the pilot cohort, but you're welcome to join this special event. The course itself will be kicking off on the 22nd of March, and many of you who applied for the course are here today, and we warmly welcome you. This is a great opportunity to get a feel for what we'll be doing in the course. The key document for this is the WHO guidance issued in 2016, again on this topic. I'm now going to turn to María so we can understand what this publication is about, and and what its purpose is, who is it for, and how do you believe it can be used to make a difference?
Well, thank you very much, Reda, for giving us this opportunity. It's a pleasure working with in partnership with the foundation. And also it's a pleasure to see faces. I kept seeing faces of many colleagues who joined the room today, who definitely contributed in one way or the other to make this a reality. To start, I want to say that this document that you share on the screen and based on which this training will be implemented, this pilot training, was done with the support of many, many colleagues, but I want to mention some of them who were the fathers or the godfathers and mothers of this. And it's the group of colleagues composed by Michael Boyd, Cheryl Bushberg, Steve Evdon Jackson, Donald Miller, Denise Remedios, Angela Chogran, and Donald Frush. Don was really the godfather of this, and he's in a way the ambassador of this key expert group who created this guidance in English. Now it is already available in Spanish, in Portuguese, in French, in Japanese, and soon in Chinese and other languages. The purpose of this guidance, we consider that there was a gap in the skills of the healthcare providers, specifically in the area of how to communicate about radiation benefits and risks. Not just about the risk, but about a balanced communication, not only with the families, the patients, and the parents, as we will see today, also very interesting testimonials, but also in the interprofessional communication. So we consider that we should produce something to basically initially targeting the healthcare providers, and this is why the book, the guidance, the subtitle is Guidance for Healthcare Providers. But soon after, we understood that we needed tools also for patients, for families, and we developed a series of leaflets, derivative products, targeting specifically this group of stakeholders who are the most important stakeholders because we work for them, for the patients, for the families, for the community. So that is the purpose of this book. We have been working so far trying to use it with Joanna also. She's here because we work with her in many countries, particularly in Africa, using the book for training. But now we are starting a new approach with a different type of learning that will be the one that we will pilot this year with a more proactive interaction between peers and also with us ready to talk to all of the trainees. And well, we know that there are many applicants. We don't know if all of them will be able to do the first pilot, but definitely this is a community that is growing up, and we hope this will be the starting point for more pilots and experiences also in other languages.
Thank you so much, Maria. We've got so many messages, hellos coming in from literally all over the world. In fact, more than 3,300 participants registered for this event. I just have to apologize because we're not going to be able to acknowledge everyone, but already I want to offer a round of applause for being so great in numbers and responding to the invitation for this special event. This course, the information for the course was shared more than 1,400 times. 1,248 people applied for the course from 90 different countries, definitely showing that both the level of interest and the remarkable response. Now, for applicants, and I want to thank all of the applicants who spent time on sharing 288 challenges in relation to this topic of communicating on radiation risk in a pediatric context. 128 lessons learned that applicants said, I want to share. I have something that I learned that I want to share. And last but not least, 117 success stories that came together through the applications. So we're looking forward to discussing these. And in fact, with Maria, Don, and Joanna, when we reviewed these stories, we found remarkable testimonials from stakeholders from all regions around 4 key areas. And in fact, This event is going to be structured around these areas. We're going to dive right in to discuss patients and parents' anxiety. And I'm pleased to introduce Charlotte and Boo from the Geneva Learning Foundation. Together with Charlotte, we're going to be, let me see if I can bring her up on screen. Here we go. Hello, Charlotte. You're going to help me read and summarize some of these testimonials. So let's look at the first one. And again, you'll see this is truly international. First testimonial is from Dominica, and it's a radiographer or radiological technologist who works in a public hospital or health facility. Really talks about how intimidating imaging rooms can be, and says, I create a comfortable atmosphere for the child. I let them understand that imaging will help get a clear idea as to what is wrong. So that is the first testimonial that we wanted to share. So we'll look at 3 of them, and then we'll go to the discussants, to María, Don, and Joanna, to ask them to share their insights. If they were sitting together with this colleague from Dominica, just one-to-one or in a small group, and what would they say? How would they share their experience? What would they share back? And we're really talking about experiential learning. That will also be at the heart of the pilot course. Second testimonial is from Nigeria, and this is, again, a radiographer, this time working in a private hospital or facility. Charlotte, over to you.
Thank you, Reda. Responding to a family's anxiety, I was able to identify the challenge by noticing anxiety in the patient's relatives. Then I had to reassure them of the safety of the procedure and my professionalism as a well-trained and licensed radiographer. That way, I got their consent and did the procedure.
Wonderful. And we have a third testimonial. And again, we're looking at all the messages and comments that are coming in. There's literally hundreds of comments and messages. Most of you right now are saying hello. Francis Chinuuba says, quite interesting. So Francis, tell us, what are you finding interesting about these first 2 testimonials? That's what we're going to be asking our discussants. This third one is from South Africa. About a comfortable atmosphere, making the imaging process very playful. I had to make the imaging process very playful by telling the child we're taking selfies, and the collimation light was a flashlight, so the child was able to relax, and the parents were also participating. So now I'm going to turn to María, Don, and Joanna. Let's start with María. If you were sitting with these 3 colleagues in the room, what would you say to them? What would you share? What would be your guidance, your feedback? What experience would you share? And how could the WHO guidance be specifically relevant to these types of situations and this question of the anxiety that patients and parents may feel?
Well, I will respond probably the second part, what the guidance could help, because I think Don and Joanna can refer to what they would say as peers in the site, in the hospital. In the guidance, we try to address the importance of considering the pediatric patient as depending on the age, but respecting the respectful treatment of these patients. We discussed there the issues of the parents' consent, but also the children assent. We cannot force them to do a procedure, and it's very important. And through this, developing these skills for communicating the radiation benefits and risks, and the benefit dialogue with the parents, but also through creating this atmosphere that will make the imaging rooms less intimidating, we will be reassurance the patients, the pediatric patients, and also the parents. And in the guide, there are some tips and tools for that, and we also plan to address this during the training this coming months. But I would like now to listen to Don and Joanna to see what would you say in the ground.
Thank you. This is Don, and first of all, welcome to all of you who could join today. This is going to be a great experience. Your questions, comments, experiences, challenges are shared amongst all of us who do this. And this is really going to be a shared learning experience. So thank you for your participation. Just two aspects to what the context is here and the question asked is, as Maria said, there are two groups that we all deal with. We deal with the parents or the caregivers and the children. And it's a special challenge, but it's also an opportunity for all of us to understand that that's often two different dialogues that we have to have and recognize the importance of that collective embracing of both of all parties in the room. And just in a general context of any communication, particularly in a stressful situation of imaging care, the three aspects that I look to have effective communication are to be informed, and to be sensitive, and to be engaged. And those are three different things. You can be engaged with someone without being sensitive and compassionate and understanding that situation. So all those elements to me are very important and have been touched on many of these testimonials, but it's a way to wrap everything together by using these three elements.
Thank you, Don. Joanna.
You are muted, Joanna.
This has to happen at least once in each meeting.
It must happen to someone, so it's better.
Every time, yeah, it happens.
So we are following Maria and Don. It's really, really important because we as a medical professionals, we create these beautiful guidelines that WHO and the whole group created. And then what's happening with this? We just need to be sure that people use it as a very valid course and valid information, because all of us cannot know everything with all of the developments. And if you are busy in your clinical life, this part of the guidelines, it's really good, because as a practicing radiologist, pediatric radiologist, I have everything in one place. And what Don said, giving information to the parents. 50 years ago, the medicine was very structured and very dominated by doctors. So everyone was saying the child needs the X-ray. Now it's a dialogue. It's a communication with the patients, with the parents. And if you give them information, if they will understand what is needed from them and why we are doing it for, it will be much, much easier to establish this dialogue. And I'm in the very fortunate position, I think, because I'm a professional from one side, but I'm also a parent. I'm the mother. And having two lovely and very lively and active children, I was on the receiving end on several occasions. And just a couple of examples. If I take my son to my hospital, to my X-ray department, I feel very relaxed. I know everyone, I know the department, I know the equipment, I know what they are doing. When I go somewhere else, I start asking questions. I'm very nervous. I'm worrying what they are going to do to my child. I know everything about the X-ray, or most of the things, but I still worry as a parent. So we need to understand that the parents who are coming with children without the medical knowledge and the profession, they will be in complete different situations. If we have a department that there are no information, that are just sitting there in these very stressful situations that they need to be X-ray or have a CT, they won't be very cooperative. On another hand, if we have the department that there are a lot of information provided for the children, maybe a little bit leaflet in the simple ways or in the pictures to give it to the child, the same give information to the parents, it's a completely different situation. Then we can establish exchange of information, we can explain everything, and then we can make them comfortable. And also, it's also very important in all of these testimonials, what they said, to develop the dialogue, but also time. We need to be sure that we have enough time for each parent and each child to treat them individually and give them enough time and enough attention what they need during the examination. And I'm sure that everyone, like me, found it really, really difficult in the everyday life.
Thank you very much for this. This was a first segment I want to offer a round of applause to our discussants, to the panel as well. We know we are connecting from all over the world, defying distance to come together. So it's important to hear the sounds of joy and applause as we connect, professionals from all over the world connected to each other. Our next segment is on providing explanation and engaging patients and parents. So let's look at the first testimonial here. This one is from Malta, and it's from a postgraduate student who says, as part of my PhD studies, I've interviewed a number of parents. Parents expressed a need to be reassured that referred examinations were important for the child's management. They appreciated being informed that radiographers are trained to reduce the risks and that these are quite minimal. So that's the first testimonial, first of three. The second one is from Zimbabwe, and this one is about reassuring information to patients and parents. When doing exams, because parents look at the time of screening as the length of the procedure and are always worried about the length of the examination, I have learned that if you explain to them that there's less radiation during screening and that you'll minimize the dose, it becomes more acceptable to them. Also explaining that you do intermittent screening and that the length of screening is being recorded, they seem to come round. Informing them that the machine has a built-in device to also monitor the time of screening and the bell rings if it is too long. If you finish the procedure without the bell ringing, they're happy. Charlotte, over to you for this third and final. This one is quite long, but also quite interesting. Over to you.
Yes, and this one is from a radiographer in Nigeria. He says effective dialogue to inform and reassure. So being in an environment where children are exposed to sickness and disease, a female pediatric patient was brought in for chest x-ray, and I, as a radiographer, I gave guardian instructions on how to prepare the child for examination. I noticed a change in the expression of the guardian, so I asked why. The guardian expressed concern about what she read online and also heard from people concerning the effect of radiation on pediatrics and how vulnerable they are to radiation effect. I listened attentively to her. Then I began to tell her about justification, that is the benefit of the child having the chest x-ray far outweighs the risk the red were told about, letting her to know the examination has been vetted for first. So after which I told her about optimization, and then I reassured her and gave her confidence. Having being exposed to the guidelines on radiation protection and also ways to communicate to either child or family have helped me in tackling the issue. I think people need to be enlightened and the more concerning medical radiation exposure and also about justification and optimization in relation to it.
Thank you, Charlotte. So we have, before we go to our discussants, we have some comments coming in. So the first one, really a kind of substantive comment. We've had lots of hellos and lots of praise, which is nice. But Ifeoma Nwobi Nawulezi says, I agree with being patient with the children's parents or guardian, giving them enough attention during their time in the department. We also have Ze Gonlabes, who says, it's important to reinsure that doses in different hospitals or countries are similar, so the risk conversation with parents is accurate. So again, we're talking about providing explanation and engaging patients and parents. Of our three discussants, who would like to go first?
Well, I can comment here. Once again, these testimonials are extraordinary. To hear the common voice, whether radiographer, technologist, medical physicist, pediatrician, radiologist, to hear the shared experience, I think is particularly strong and unites us in sort of this mission in improving communication. So that really has been quite a good lesson for me as we do this. I want to point out one really important thing as we talk about this whole risk environment, is that we switch it around, and I personally believe that we need to begin every conversation and every engagement with one thing, and that is the benefit of what we do. I think we underemphasize that, and then we get lost a little bit in the nuances of relieving anxiety about the radiation, et cetera. So the first part of my conversation is always, this is a really helpful examination for your provider to make important decisions. And once you have said that, I think you take a little bit of the edge off the concern there of parents. Because what I think that parents want to know, the two fundamental things they want to know when they come in and have an examination and engage with you is, number one, do you know what you're doing? Do you understand the technology? As illustrated in some of these testimonials, that explanation is helpful. So are you informed? Do you know what you're doing? And fundamentally, that you will take care of them. And that is the sensitive and engaging part of those three elements of communication that I discussed. So I know what I'm doing, and I'm going to clarify it for you. And I just want to say that we are going to take care of you and your child, always introducing the fact that this is an important and necessary examination in that dialogue. And I think that changes the atmosphere of the subsequent dialogue. So that's an approach I have found successful. Joanna?
Yeah, it's incredibly important that the parents will understand what we are doing with their children and why we are doing it. And this is why we need to communicate with them. And also the language is incredibly important, because in our situation, when I will talk to Don or to Maria, I will talk about the justification of the person and those limits. Parents very often don't understand this one. So we need to take it back and communicate with them at the level that they will understand and buy into this whole process. And one little thing what came from these two comments that you read to us, that it's really important that we are all doing the same things. So if the parents will go to the different departments and the different hospitals, they will have the same message and the same information. When the pediatrician or the other clinical colleagues will talk to the patients and to the parents and explaining why the procedure is needed and about the procedure, we will talk in exactly the same way. So we will keep the same information that all of the medical world is the same. And what's happening recently, and I'm sure that it's happening in every country, that parents will go to the internet and they will Google all of the information. So again, we need to know more, and we need to be able to address the patient's worry. And this is what I really like about the document that has been produced by WHO, the guidelines, because the whole first chapter, and I'm sure that you know it, they have the background information and the scientific information. So if I give the patient information, I will tell them exactly what's the same, what Don is saying, or what Maria is saying, or Dennis is saying in London, because this is there and it's really available, and the patient can go to the internet and download the same information. So that's, in my opinion and practice, it's really important.
Thank you both. Before we go to Maria, we have some great comments coming in. One is from Obed Otobo, who says, when parents are informed about the risks and benefits of the procedure being performed for their child, they are more cooperative and they help to calm their children for a smooth examination. Amanda Jimenez says, I'm a technologist in radiology and I work as a teacher in technical courses in Brazil. I worked for 7 years in an emergency care unit for children. I think a course with this wonderful and very important theme. Thank you so much for the opportunity. Last comment that I'll share, and there are many, and I apologize for not being able to share everyone's, is from Eric Thelly, who says, making parents understand exactly what the procedure is for and its benefit before and after the procedure is very necessary. So back now to Maria Perez for final feedback on this issue.
Yeah. Of course, yeah, and I am also reading lots of comments here about age. There is a comment very much linked to that, how to address the different ages. I think this is essential. We will discuss through the course the 6 parts of this cube. I don't know if you can see this cube. These are the 6 attributes that communication that WHO is promoting. But exactly, it was mentioned here. It has to be understandable, it has to be actionable, timely, accessible, trustable and accurate and relevant. So all these components of this cube are applicable to the radiation risk communication in the pediatric imaging settings. And if we are talking to the parents, or we are talking to a very little boy or girl or an adolescent, we should tailor our language according to that. And as Joanna said, it's important that education and training in radiation protection is essential as the background that all the healthcare providers should have, because then they will have the elements, if they, in addition to that, have training on to develop their communication skills, they will be able to tailor the messages to the age of the patients, to the level of education of the families. The language, this is a big challenge, the language, but it has to be a challenge that should be considered at local level. And then to develop the tools to have verbal communication or maybe posters. I mean, in the testimonials, we learn a lot about different mechanisms, but definitely the messages will be basically the same, is to bring trust, not to have empathy, to understand that any question that may come from a child or from the parents is always respectable. Even if we think some questions are really surprising us because are based on what they found in the internet, and sometimes it's really amazing what they found. We should have empathy, respect them, and to explain them based on the scientific evidence, but tailoring to their language. And this is, the training is about that, about the scientific basis of the knowledge on radiation protection and safety, but basically how to develop skills and tools and approaches to message mapping, etc., to improve the communication. That's it. Thank you, Reda.
Thank you, Maria. So we have a question from Elena Cotelo.
You want to say something?
And I'm sorry to interject here, but one thing came to mind, and this is a great question, a great topic, and it's difficult to construct a age-related conversation that addresses all situations. So it's really important to align with the parents and caregivers here, because they actually speak the language of their child the best. And we've all seen, I know Joanna's seen and Maria's seen, and all of you in medical care have seen, if the parent isn't aligned, if they're anxious, this is going to roll out to the child, and that examination is going to be limited and be a poor experience in some way. So one quick tactic that I have found very effective in aligning the parent to be able to get their child less anxious is to simply say at the beginning of their question related to radiation is, "That is such a good question, and thank you for advocating for the care of your child." Right then, you've got them by the hand, your arms around the shoulder, you recognize their intelligence, their care, their compassion for their child, and everything flows much better after that. So I always start out saying, "Thank you, that's a great question. I know how to answer that." And then everything, I think, falls into place much easier.
Yeah.
Great. So we have a comment, actually a question from Elena Cotelo, who says, what about parents who ask for a TC procedure for their child, but it is not necessary? And I believe this is a significant and recurring issue that the group of experts who worked on the WHO guidance and every of the community has given significant thought to. So I'd like to ask perhaps Maria to respond to Elena's concern about this type of situation.
Hello, Elena. First of all, nice to see you, even in a picture. In the guidance, it is addressed that, because it is so dangerous for the outcome of the treatment or the care of a child not to perform a CT that is justified, as well as performing a CT or whatever radiological procedure that is not needed. Both are not good for the medical quality of the care of the child. So in the book, you will find a list of questions. Some of them are developed to address those topics, exactly those situations, when the parents want to have something that is not indicated. So there is a proposed approach there called message mapping that you can see in the book, that we will try to also use it during this training and other activities, which is to develop your message on how to respond that this procedure is not justified, is not needed. Probably the word justified, I don't understand, but that the procedure is not necessary to manage the diagnosis or treatment of the child. And then you can provide 2 or 3 supporting messages why this is not needed and what are the risks if it is done without certification, etc. And maybe you can provide some resources, examples. You can provide links for them, for more documents that you can offer in your hospital. And first of all, starting, as Don said, not criticizing the parents because they are pushing you to have that. You should empathize, have empathy, and understand that they are anxious. So understanding them, you can explain with the scientific elements, but presented in a way that is understandable. And I am sure that Joanna and Don, you will have more examples of how this very common scenario, very common, is addressed. And there are some testimonials, I think, referring to that Reda will show to us soon. But
indeed, thank you.
I don't know if Don and Joanna want to add something, or you prefer to move with the testimonials.
I suggest we keep going for the sake of time, in order,
Okay.
and there are many more comments, and again, sort of comments on the testimonials coming in from participants online as well as in our Zoom room. I want to highlight before we move, on engaging on this question of providing explanation, engaging parents. This comment from Operaji Franklin, who really breaks it down into 4 points. According to him, this is what he does, I'm guessing. Welcome the child with a smile, calling them by name. 2, make explanations simple for ease of understanding. 3, tell them how important the exam is. And 4, make a simulation of what the exam is about.
Yeah, great.
All right, we're now going to talk about the interaction between professionals, and here we have 2 testimonials. The first one is from Saudi Arabia, and this is an assistant professor of medical imaging. Talks about advocacy communication to improve behavior, and we've highlighted in red here. I coordinated with the hospital administration to conduct a training course to explain the risks of radiation, especially when imaging children. And the second testimonial is from Kenya, from a private hospital. I was once employed in a health facility where radiographers were not taking precaution on the amount of radiation. To curb this, I suggested to the management that we have continuing medical education on communication skill in pediatrics and issuance of flyers on the uses and effects brought about by radiation in the hospital setup. So that's the 2 testimonials to open up the discussion about the interaction with professionals. Who would like to kick off on this one?
I give the floor to the pediatric radiologists to answer.
All right.
I'll start. It's a great question, and really what we are talking about is engagement between all stakeholders with respect to risk communication. So it's not only between referrers and radiologists and technologists, but it involves administrators as well, and it really gets to the point of having a collective investment in your practice, your hospital, your region or country in providing a good environment for medical imaging that is able to address all these things. So we're really stepping away now in this series of testimonials from the day-to-day trench interaction with the parents of what is a successful formula for this. And so it comes back to an operational a part of it. And I will say that the folks joining today have such a strong voice in this based on their experiential basis, is to begin to develop these programs, these networks, to get information such as with the radiation risk communication document out, look at that, and help the entire practice to develop strategies to provide this information. And I will say that we own this. We as imaging professionals own this. It's not the responsibility of the emergency room doc. It's not the responsibility of the pediatrician. If we say they're not informed, it's because we haven't done enough to inform them. So take that passion with you, take your voice of that experience and say, these are the holes that we see. These are the gaps that need to be filled. We are the best to do this. Here is information, a guidance, a document that tells us how to do this. So now we can begin to develop a more formal program where issues of appropriateness, issues of getting pamphlets out and so on can be developed.
Thank you, Don.
I don't see Joanna. I don't see the screen. Joanna, yeah, you are there.
Yeah, I'm back. Sorry, it's not very stable, but I completely agree with Don, because we can achieve this only by being one big group and one big community, leading us in the diagnostic field, but also in the clinical team with all of the administration, with all of the helpers and other staff in the hospital. And if we don't make them to be engaged with us and buy in, and especially understand why it's so important, we will never be able to make the challenge. So if, for example, from the first testimonial, the professor of medicine will go and say, please use the different protocols, it won't be achieved anyway. It won't be received in the nice way. We need to show why we are doing it. And then we will have the understanding that I'm sure that everyone will build into it. And this is really, really important. And when people start doing it as a clinicians, they don't understand, they don't have enough knowledge. So medical physicists, radiographers, this is a great role for you to have it and to lead all of us into the common goal.
And I can join something, Reda, because I am also reading some comments which are very interesting in the chat and are all in line with this. A comment on the importance of having the radiology department all together and the importance of having evidence-based advice like the imaging guidelines. This is, in a way, this tool on communication should also improve the practice. Because if some of the testimonials refer to having posters or something in the hospital with the evidence-based recommendations for using or not using, for instance, CT. But in the testimonials, we also found that problem on the interprofessional communication, particularly between, this is something that we perceive in these recent testimonials that we reviewed in this last week, between the radiographers that in many countries work alone because not always they have the radiologists close to them, and the referring physicians that sometimes may be a surgeon or an emergency doctor, etc. And it's difficult for them to convince why this is not justified because it comes from a doctor, but it is in the referral guidelines that it is not applicable. So it's difficult. And of course, they should need the support of the radiologists, but sometimes they are not there. So having a teamwork with periodical interaction and interprofessional dialogue, this is why in the guide, it is the two areas were proposed by the group that developed the guide, the interprofessional dialogue and communication, and then the communication with patients, parents, and community. And these two should be in a way articulated and integrated. We have no time, I will not say more, but thank you for all these comments also in the chat. Thank you.
Wonderful. Thank you so much, María Perez from the World Health Organization, Joanna Brown, President of the World Federation of Pediatric Imaging and Chair of Outreach Committee of the European Society of Pediatric Radiology, as well as Dr. Don Frush, who's Chair of the Image Gently Alliance and Co-Chair of the Global Quality Safety Alliance of the International Society of Radiology. Those are our three discussants. We have a number of actually 57 distinguished panelists who've joined us in the Zoom room, as well as hundreds who are watching online. Want to warmly welcome you again. Thank you for joining. And we have 8 minutes left to talk about effective communication, which is a very short time, but let's try to be effective and concise as we review some of the testimonials here in order to have the final 10 minutes to really open up the discussion and to hear from other distinguished guests in the room with us. I want to thank everyone for the quality of the comments and contributions. You'll be able to find them online on the Facebook post or the LinkedIn page where this event is being live streamed. So this testimonial is from Portugal and about effective communication to address parents' concerns, someone who works in a public hospital. I explained that the current studies no longer indicate the same need to use this type of protection, mainly because the radiation risks of this particular examination are extremely low. A second testimonial from Nigeria, a radiographer in a public hospital or facility. In considering the effects of radiation on pediatric patients, both carers and radiographers need to consider precision and quality imaging of diagnostic value and avoid repeating radiographs is always a top priority when I attend to patients, especially pediatrics. I've always approached communication from the angle of properly explaining the procedures to the patient and their relatives. I decided to discuss radiation implications with the relatives. So that is the second testimonial. And then the third is from the United Kingdom, and really about the positive impact of effective communication. This person says, I was able to have a conversation with a parent and use the poster resources provided by the BIR to help with the discussion. I then worked, going beyond this one sort of case, I then worked alongside the medical physics team in the trust I work at to produce a standard operating procedure. So let's open up again to hear from María, Perez, Joanna Brown, and Don Frush.
I will give time for them because we have very short time, and I don't want to miss the testimonial on the lessons learned in COVID. Please put that one also.
Right.
But
Joanna?
give the floor to, yeah.
Joanna.
Just a very, very short comment on the testimonials, that it's important, as we say, effectively communicate and take any possibilities to do it. Like in the second or third testimonial, use the posters, use the coloring books for children, because this will give us better contact with the children. Use the teddy bears, use the dollies. You who are working with children know how to do it, but we have a whole range of material that we can use it and just utilize all of it.
And just to add to that great comment is one strategy is to provide the frontline providers, technologists, radiographers with specific bulleted talking points to address common questions, frequently asked questions that might come up related to the use of gonadal shielding, related to the use of CT radiation, et cetera, and have them be comfortable and familiar with that. And that way the practice or the institution, everyone is talking the same language. The problem is when people are saying different things and illustrating different things, then it's confusing for the general population. So sometimes orchestrating a single strategy that through these bulleted talking points has been an effective thing that we've found here.
Reda, may I say a quick thing? We have seen here another example of how effective communication can improve the outcome and improve radiation protection. And it is an example of how an imaging expert, a specialist, educating, talking to a referring physician could change from a nuclear medicine procedure to a Doppler sonography without exposing the child to radiation, to ionizing radiation, and it was effective as a test. So an example where communication, and effective communication, evidence-based also, can improve radiation protection also. Out to you, Reda, because we are very...
Yes, we have all of, let's see, we have 4 minutes left for this segment. Unfortunately, we're not going to have time for the lessons learned, but Maria, I believe you said you wanted one of the challenges. Was that right?
No, the first testimonial after lessons learned is something that came from India, and I would like if you can move and put him. Yep. Because it was, this is a lesson learned, and I think it's interesting because this was a gap, or not a gap, I cannot say it was a gap in our guide. We never even imagined when we wrote the guide that these kind of situations may happen. And this is an example of how radiation risk communication may be adapted to a new situation like the pandemic. So I don't know if you can share that slide.
So I'm showing it now. You may not let me. So radiation benefit risk dialogue during the pandemic. So this is from India, as you said. Being one of a few pediatric radiologists in my city, I identified this inadvertent ethical issue, which was that physicians were taking shortcuts of getting high-resolution CT scans in all the patients and contacts for quick and effective diagnosis. So what did this course applicant do? In collaboration with the radiographer, CMEs of GPs and pediatricians were conducted, explaining to them the effects of radiation on children. They made a flowchart for imaging centers. It was rare that informed consent was taken or that the effects of radiation were explained. And they then used the TDS concept, time distance shielding, effective against radiation as well as handling COVID patients. And the lessons learned, we could achieve near 100% success rate when we effectively communicated with patients, relatives, as well as referring doctors. Can you tell us, Maria, what for you is striking, significant, important about this testimonial?
No, it's just to raise awareness of all the people listening to us that now we are facing this challenge of COVID. And we know, and we work with many of you, I can see Donna and other people who work with us for developing the safety briefings for protecting radiographers and practitioners in COVID. This is an opportunity where we have to be creative and to use our radiation risk communication strategies to bring messages that at the same time will help us bring messages for preventing infection prevention and control, because these two things should go together now in the current situation. So it's just an example of lessons learned, how this is a change in a scenario. Public health is a change in a scenario. But radiation risk communication will always have a place when you use, especially in pediatric imaging. That's it, the only thing.
Thank you so much, Maria Perez from the World Health Organization. So we are, unfortunately, we have 10 minutes remaining, and we have distinguished guests who distinguish themselves because when we sent out the call, can you help us share the announcement for this upcoming WHO pilot course on radiation risk communication? More than 270 health professionals, not all of them directly concerned with radiation risk or pediatrics, really took it upon themselves to share the announcements in remarkable ways. In fact, the announcement was shared more than 1,400 times. Now, many of the distinguished panelists in the room with us are themselves very active leaders and professionals in this community, have been just advocating for improved ways of communicating. So I want to now ask for, with the time remaining, that we really focus on them and invite you to, if you are in the Zoom room with us, to raise your hand so we can then unmute you and hear your contribution, your thoughts, having listened to this discussion. So I believe Bala Muhammad has, let me see if I can, yes, or actually Sarah Hagi Al-Bahiti, sorry. Sarah, the floor is yours.
Thank you for this invitation. Lovely to see everyone, Don, Maria, Joanna. As you all know, I've been working closely in Saudi Arabia with the Bond Call for Action, applying it here. And I'm really happy to finally see such a course that remotely our physicians, radiologists can start and try to raise their awareness and engage more with the teams, the multidisciplinary teams that are needed to change this practice. Some of your testimonials are exactly what we are facing here, especially with using adult protocols for pediatric patients. This is unfortunately a very alarming situation in my country. When we were about to start the national diagnostic reference levels, we realized that all our pediatric protocols need to be redone to start with as a step zero. So it's very common here that children, unfortunately, they look a little bit old. If they're 10 or 11, radiographers immediately use an adult protocol for them. So we are really starting from that situation and building up on it. I'm very happy to tell you that the local governing authorities, the Saudi Food and Drug, and the Ministry of Health, the Saudi Central Board for Accrediting Hospital Institutions have a priority called radiation safety. And I'm on board with a lot of colleagues to establish the minimum requirement for any healthcare facility. And of course, everything you are discussing here today is going into that document that will hopefully be the standard in the coming years in this country.
Thank you very much for this contribution, Sarah Hagi Al-Bahiti. We have many hands raised now. I'm going to turn to Maria Perez, who knows many of the folks in the room. Maria, could you help me? Yes, could you invite?
Well, I see at least Graciano Paulo. He helped us translate the guide into Portuguese. So I think he has the right to say something, because you are a champion in the translation of this guide. And we have also colleagues from India, Jonathan, Hem, Sarah, and I lost now, but we had Donna, the president of the World Federation of Radiographers. But Graciano, I would like to hear from you.
Well, thank you. Hello, everybody all around the world. And I would like to start by thanking WHO on behalf of Maria and all the team, Don, special friends, Dennis over here. It's very nice to see you all discussing this very, very important tool, this guidance. We have translated here into Portuguese and distributed all to the Portuguese-speaking countries, which is a huge community, as you know. But I would like to call the attention for the need. The testimonials we saw and we heard today are very, very important. But I would very much like to push this community for the next step, that we have this very, very well-written, easy to read document. But I think to make it more effective, we need to find a way to include this tool, this document, into the undergraduate level of all radiographers' education systems, medical doctors, medical physicists. Because to communicate is per se a very difficult and challenging science. It's not everybody that can communicate in an effective way. So we need to probably develop a strategy to include this, how to communicate effectively in the undergraduate courses of all the professionals. And especially as we saw, most of these testimonials are those, there are the interaction between patient and technology, the radiographers, as we call them in Europe. So this would be my challenge. I noted here three very important words that we are facing today in our medical imaging departments: time and pressure. Time and pressure are the main barriers to communicate effectively to parents and to child. And to children. So we really need to understand how to make the next step of making this document more effective, more readable, and to reach a highest number of professionals and universities all around the world. Thank you, Maria, and congratulations for this.
Thank you, Graciano Paul. I think I do see Donna Newman in the room, so I'd like to invite her. And I see she has her microphone unmuted. Yes, please, the floor is yours.
Thank you so much for the opportunity to speak to everybody around the world. As the president of the ISRT, who represents over 500,000 radiographers around the world, I believe the WHO has done justice to this project. In the beginning, they brought all the key stakeholders together in the team approach, which has shown an effective book being developed. I think that we are now in the time where it's time to roll out this project to all of our areas. You can see by bringing the stakeholders together again, the amount of people around the world and the professionals that we are reaching on all levels. We're getting the physicians, the referring physicians, the radiographers, the physicists, the patient advocates, the referrers. And I think by bringing key stakeholders together to roll out our message, we will have an effective pilot project. So I applaud the WHO. I applaud all the key stakeholders from around the world that help participate in this to bring this project forward. And I look forward to having success with the learning environment and the next phase of this project. So thank you, WHO, for having the foresight to bring us all together. And thank you, key stakeholders, for being involved and helping make this a success. I think that we can have success. We can develop a good project. We can roll this out. And I think we can get this to be part of our everyday practices.
Thank you, Donna Newman. All right, we have had more than 3,300 participants registered in this special event. The course information for the pilot course on radiation risk communication to improve benefit risk dialogue in pediatric imaging was shared more than 1,400 times. We had over 1,200 applicants for the pilot course. Once again, I want to thank you. The course will be kicking off very soon, so applicants will soon be receiving a letter informing them of WHO's decision with respect to their application. I want to now go back to María, Donna, and Joanna and Don for final closing comments to close this special event. María?
Well, thank you, Reda. I mean, it's a pity we have no time to give the floor to Raúl from Argentina, Heman from the International Society of Radiology, Jonathan also. All of you are have been contributing. We may organize another webinar, why not? This may be necessary. I just want to say thank you very much to all of those who have helped from the beginning for the development of this project. But also now that we are trying to move, as several of you have said, a step forward to use innovative approaches for adult learning, peer learning. Don, you told me some time ago that we will be all learning, not just people, so-called trainees, but everybody. We all are learning from each other, and I think this is the new way we want to learn. And I want to say that this project is very much linked to other two projects that we are doing in WHO now, which is related to enhancing radiation safety culture in healthcare, because safety culture has different attributes, but communication is one of them. And the other thing is another project on ethics and developing a culture of ethics in the implementation of radiation safety principles. And communication with patients, parents, and also with colleagues is an ethical duty. So I think I only can thank you very much, because this is very motivating for us to continue working. And I want to give the floor to the two experts who will be part of this course team this year and hopefully in the future. So up to you, Don and Joanna.
Thank you, María. And now let's hear from Joanna and Don.
Joanna, go ahead.
I just need to say thank you very much to everyone who joined today and who listened to the and it's part of this project, is incredibly important. And we as a professionals can make a difference for all of the patients, all of our colleagues, and us, making our work much easier and better. So it's incredible privilege to be part of it and work with everyone. And thank you, Maria, because this course and this program is incredibly important. And having this next step is, it will be very, very beneficial for everyone. So thank you. And let's do it together.
Right. And over to Don Frush.
Well, I will be brief. We're running out of time, but just a few quick comments. First of all, the fact that we have run out of time and didn't cover everything is a huge testimonial to the success and the leadership of this course. The second thing is, while all stakeholders are important in the entire topic we talked about, I want to especially call out the radiographers and the technologists. They are so critically important in this communication environment because they are the face of what we do. The experience of the parents, the experience of the caregivers is so dependent on what you all do. So from me, from radiologists around the world, thank you for what you all do. And finally, in terms of strategies and taking forward anything from this talk and the course that ensues, just remember that improved communication, that it helps us to better use our modalities, number one, more appropriately. When they are used, more patient cooperation and compliance gives us better examinations. And finally, and related back to the comment about the radiographer's role in this, is it's a better patient, it's a better parent experience. So this communication has such an impact on those three fronts.
Thank you to our three distinguished discussants, as well as to all the panelists in the room. We're now going to close this event, but this is only the beginning. As you know, WHO is launching this pilot course on radiation risk communication to improve benefit-risk dialogue in pediatric imaging. If you are amongst the applicants, you will soon be receiving a letter informing you of the decision. This is only the pilot course, so given the level of interest, we certainly hope that there will be more learning opportunities like this. We're now going to rewind some, but not all the comments. There's simply too many. Literally, thousands of participants, health professionals from all over the world who joined. Just want to once again thank you on behalf of the Geneva Learning Foundation, and thanking our esteemed partners, colleagues from all over the world who supported this, as well as to, of course, the World Health Organization for making this possible. Once again, thank you wherever you're watching us on YouTube, Twitter, Facebook, or LinkedIn. You'll find many comments and questions, and we will be following up if there are any questions or comments left without a response from us. Thank you, and goodbye.
Thank you, Reda.
Thank you to everybody. It's so nice to see friends.
Yeah, thank you, Maria.
Colleagues. Thank you. Very nice to see
Maria.
family.
Yeah.
We will continue working together in this community.
Thank you, Maria. Thank you. Yeah.
Gracias.
Yeah.
Gracias, Mercedes y Raúl from my home country. Nice to see you.